But thanks for joining, and it's nice to do this live and in person because last time it was virtual. Your mic up.
I am, yes.
Okay, great. So I know that the fertility journey is very personal to you. So I'd love for you to share your story with the group.
Yeah, sure. So first, everyone's probably wondering, why am I talking about fertility? Fertility is often viewed as a women's health problem. It's fintech. The reality is fertility actually impacts everyone. 1 in 6 people will undergo fertility treatment over the course of their life. Over 100,000 babies are born every single year using IVF and vitro fertilization alone. That's not all assisted reproductive technologies. But that's only a small portion of the incidence of this disease. In order to accurately have the number of children that are required, we'd have to have over 700,000 babies born in the US every single year using IVF. So that impacts couples, as individuals who want to have children who are single by choice, LGBTQ plus population, same-sex couples who want to have children. All of these are going to be utilizing these technologies. So it's really important to share my story and for others to share their story, talk about how common this is. Odds are every single person in this room knows someone who has struggled or is going to struggle with infertility. You may just not know it because they're not open and talking about it. There's a stigma associated with this. So similar to mental health 15 years ago, people were simply not talking about it. We realized mental health is a disease that needs to be treated appropriately. Fertility is the exact same way. Infertility is a disease that requires medical intervention from specialists. But often that journey is incredibly complicated, expensive, and overwhelming for patients. My background's in health policy, so I thought I'd be well equipped to navigate this journey as we were going through that process. And it simply wasn't true. I wasn't prepared for the emotional impact of it. I wasn't prepared for the financial impact of it. I wasn't prepared for the physical impacts it would have on my wife and how it would impact our relationship. So that's why I built Grain Fertility. So Grain Fertility is a company that helps with care coordination and support patients who are undergoing fertility treatment to help give them the support they need as they go through that process. There are so many aspects of the fertility journey that require patients to have information accessible to them, and simply right now that isn't the case. The fertility industry is really behind the rest of medicine and access to information and digitization. So we're hoping to be able to provide that access to patients so they have that information.
That's great. And I think with fertility being behind in this space, I think it also just goes in line with everything else when we think about women's health. I know it's broader than just women's health here, but I think that there are a lot of disparities and gaps, but there's a lot of opportunity, and we're here talking about technology and innovation. From your perspective, where are you seeing innovation in this space, and what's your perspective on that?
Yeah, I think that there's a ton of opportunity. One is the use of technology for more personalized care. As we understand more about the biological factors that could be impacting someone's fertility, we can provide more personalized treatments. If we can better understand if a woman's underlying cause of infertility could be endometriosis or PCOS, often undiagnosed diseases that women have suffered the conditions for years, but they just simply are missing the symptoms. They're regularly talking to their gynecologist about irregular periods, heavy bleeding, pain during menstruation, other things, but they're disregarded. Those often aren't talked about. So with technology, can we start to actually flag those so that way the appropriate care is routed earlier so we can have less invasive forms of assisted reproductive technology? IVF is incredibly expensive and invasive. So if there are ways we can try to flag how can we treat someone who has a potential underlying cause earlier and treat that? Male infertility is another area that we're just starting to talk about. 30% of all cases are due to male infertility, and 50% have both female and male causes for infertility. So how do we appropriately treat that? Is there medical intervention early on to improve sperm motility, sperm counts, other things? Are there ways that we can use IUI more effectively? Are there ways we can actually use artificial intelligence, machine learning to better identify what is the appropriate sperm or oocytes to be transplanting for this? Right now, embryologists and other reproductive endocrinologists and specialists are using their medical training to identify what are the best ones. But there's limitations in humans in the ability to check those things. We've seen so many presentations over the last 2 days about the ability for machine learning and other technologies to more accurately identify what are the best things. So these are a few things that we're really excited about in the fertility industry. But then finally, I think the underlying problem with fertility is it's incredibly expensive. We have a access problem to fertility. Only 19 states have requirements for coverage of fertility care, so that leads to inequities in care. Not everyone has to have the amount of money, education, etc., in order to have care. It's a human right to be able to have children. So I think one of the developments that I'm really excited about are innovative ways to be able to finance education. How are you paying for it? We're starting to see risk-based fertility care for the first time. We've talked a lot about risk-based, value-based care in healthcare. What if we applied that to fertility? We had to spend over $50,000 over the course of my wife and I's treatment to have our daughter. That's the equivalent of buying a BMW. But we had no guarantee of getting a baby. So if you go into a car dealership and you say, hey, here's $50,000, but you have a 1 in 3 chance of getting that car, that's a really bad proposition for someone. So we have to be able to include those type of things in order to be able to provide more equitable care.
It's a great way to kind of create a picture there. So with, obviously we're talking a lot about the technology, the innovation, the precision opportunities, but on the human side of it, how do we marry that up with the patient experience as well? I mean, clearly you can speak to that very personally as well. So could you share?
Yeah, one of the things that was the impetus for forming Grand Fertility was my wife has Crohn's disease. She has thyroid issues. So she has multiple comorbidities. We had 6 different specialists that she was seeing as we were going through the treatment process. That's a massive amount of information that a patient is required to be communicating to all of their doctors. And a little background on the fertility treatment process, specifically IVF. It's incredibly intensive and invasive for patients. A single IVF cycle can be 15 to 30 appointments over the course of a 6 to 8 week period. You're getting blood drawn multiple times a week. You're getting ultrasounds done. You're getting test results communicated to you almost daily, and your medications and protocols are changed based on those results. That's a lot of information for a patient to be responsible for. So she carried around a 3-ring binder. That's how she organized all of her information. And the number of different innovative ideas I've heard patients use, everything from sticky notes to a single thread email that they would send to their spouse. Every single day would reply to that email. So it was all in one place, what the test results were, what questions they had for their doctor, that type of stuff. So it's an incredibly overwhelming process for someone to manage, let alone when you add in someone who has comorbidities and chronic conditions they're trying to manage too. How do you communicate that to your other doctors to ensure they know what changes are made to your protocol, to your medications? With my wife's Crohn's disease and thyroid issues, we had to ensure her endocrinologist knew what was going on because her hormone levels were constantly changing. How did that impact her thyroid medication? Are there adverse reactions to her for a gastroenterologist to manage her Crohn's disease, considering there's so many biological changes happening in a very short amount of time as we're trying to replicate ovulation and get the body primed to try to do it. So these are all the things that patients deal with on a regular basis, and it's incredibly overwhelming to them. And I say all this because even if you don't treat fertility patients specifically, you're not a reproductive endocrinologist, and you're practicing medicine, you are treating a fertility patient. You may just not know it. And so they are dealing with so many things as they go through that process that it's important for everyone to understand that. And I think we have it as a responsibility to give those patients the tools so that they know how to manage that, and we can have more appropriate, comprehensive care that's coordinated amongst different specialties, so we can treat that in a more holistic way as opposed to the historical way of siloed care where we're only treating one health system at a time.
Yeah, I think it's an interesting point too, because a lot of times when we think about health disparities, we're thinking about geographies or economic situations, but that the person with multiple comorbidities and other health challenges, that adds complexity and cost. And you talked a little bit about the expense of fertility treatments and what you have to go through. You talked a little bit about maybe a risk-based approach moving forward. Do you have any other thoughts as it relates to creating more accessibility from a cost standpoint in the fertility journey?
Yeah, one of the things that I'm really excited about is, and I think what I posit is that in order to solve these issues isn't just a payment issue. This isn't just ensuring everyone has insurance coverage for an incredibly expensive thing. We have to figure out ways to drive down the total cost of care because it is too expensive. One way we can do this is through decentralized fertility care. So you only go into a fertility clinic a few times when you're having invasive procedures done, whether it's a egg retrieval, you're doing your embryo transfer, you're doing your final ultrasound after your 2-week wait, which is essentially the really stressful period after an embryo transfer and implantation that you determine whether or not it was successful and someone's pregnant. That's the most stressful time in the entire IVF process. But for a lot of the things, they can be done remotely. They can be done at other sites of care. If you're just doing blood testing or ultrasound, we saw a couple people talking about POCUS. Other ways to be able to do these types of monitoring that are less invasive and less time consuming for patients is better overall, and I think that will help drive down care. There are only around 450 SART accredited fertility clinics in the United States, which means there are huge geographic areas where patients have to drive hours for care. Imagine having to drive 90 miles round trip just to get a blood test done or just to get an ultrasound. That's what patients experience every single day. And one of our early customers at Grain, she's a military spouse. Her husband moves around every single year as he's deployed across the United States, and she was more recently in Pennsylvania. And then she was going to Baltimore at Johns Hopkins for care. So she drove from Pennsylvania to Baltimore every single week, multiple times for her treatment process. Unfortunately, it didn't work, and so she had to spend a lot of money and a lot of time and did not get a baby out of it. That's an incredibly intensive process for a patient, and it's something that really does impact their psyche and question whether or not they should continue this. And that's a real hard choice for a patient to make is, am I prepared mentally, physically, and emotionally to go through all this and still not have a child? And that's a really hard thing for a patient to recognize.
So clearly, the journey, the fertility journey for people who are having challenges is not fun. It's expensive, fraught with challenges, but there is a lot of hope with the technology, with the innovation that we're seeing, making the changes. And in your case, it's a success story. You have a beautiful little girl. And as we close out, would you like to share a little bit about what your experience has been through, as actually getting the pregnancy and then having the baby and life now?
Yeah, so we went through 4 years of IVF to go through the process. And over the course of our journey, that was 6 total cycles, 5 of which failed. We had 1 early miscarriage in our process. We had to go to 2 different fertility clinics. And then over the course of that time, my mother-in-law passed away from breast cancer too. So we knew early on in that process that my mother-in-law would never get a chance to see our daughter or son, whatever we had. That's what patients deal with as they go through that. And so I started to devote myself and using my background in health policy to advocate for expanded care. How do we try to make this process easier for others? That's how I got involved with Resolve, the National Fertility Association. And that's why I founded Grain Fertility. It really was a way for me to be able to use all of the things that I've accumulated over my health policy career, understanding health IT and digital health, to try to make this process better for others as they go through this process. And I'm constantly reminded about how lucky I am to have a daughter and know that I was successful, considering that data shows only around 65% of people who go through 8 or more cycles are going to be successful as they go through this process. And so especially if you're an older woman or male, that starts to decrease that probability. So we have large numbers of people who don't have what I have. And so what we're hoping to be able to do is to make that experience easier for them, give them support they need, and then also empower them with information and data so they can make more informed decisions in consultation with their care team. How can we try to make this process more data driven? How can we try to improve outcomes? How can we try to do all these things that this room is talking about this week? And that's why I love these type of conferences and appreciate the opportunity to have a discussion around fertility and how it fits into the larger healthcare system, because reproductive healthcare and fertility is healthcare, and it is something that we need to appropriately be working on trying to have innovative solutions for.
Well, thank you for your perspective. I think it's nice to have a male perspective up here on this topic, and best wishes to you and your daughter. Thank you.
Thank you.
Thank you.